Ask AJ. I think those two things feed in really nicely to the third thing that we addressed in the article, which is digital transformation. You hear a ton about the use of technology in healthcare, and it's primarily around treatment and diagnostics, rightly so. Nobody's arguing that that's not an appropriate place for those efforts to be spent. But if you look at just the two things that we've talked about thus far, especially if you go all the way back to interoperability, the reticence to engage aggressively in digital transformation efforts, specifically in the administrative side of healthcare, I think is just continued to perpetuate some of these problems that we've experienced. And it's not, when you think about it, medicine in and of itself is a very conservative culture, right? You're dealing in health, you're dealing in life or death in many cases. Right. And so there's a natural conservatism that comes along with all of that. And I think what happens is that conservatism that can sometimes take place from a caregiver perspective creeps into what I've always called doing the business of healthcare. There's being in the business of healthcare, and there's doing the business of healthcare. Part of that, doing that business, is this administrative activity that happens in the background with collection of information, with transmission of information, with manual tasks, again, faxes, unstructured data all over the place. And I think that now is the time that organizations in the healthcare space who have perhaps put off making an investment, looking substantially at digital transformation, really need to be thinking about it much more seriously in the ways that it can help some of these other problems. Because it's impossible for any of us to look and say, well, if they had done this before the pandemic, how much better things could have been. But common sense tells you if certain things had been done before the pandemic, perhaps we would be seeing some differences, specifically from an operating margin perspective in healthcare today. What do you think about that?
Yeah, it's, I've had the joy of working at a variety of different healthcare systems. And I always say the more money we can save on the administrative side is the more money we can put into quality patient care and changing people's lives. When you're going to a healthcare provider or a hospital, it's not you're not going there for something fun and exciting, right? You're going there because you're having some sort of an event. And what you really want is that patient provider experience. What you don't care about is how are they processing their AP invoices? How are they, doing all that back end stuff is really, it's a necessary evil. It's not valuable to the patient provider experience, right?
Right.
And historically, I spoke at a conference, and it was a conference of like administrative healthcare folks, right? It's all your back office people. And I did just a quick survey, and I said, how many of you have rethought your processes that you use in all the back office and payroll and accounting and AP? When was the last time you changed those significantly, employed new tools, blew up how you do it today, rethought it, whiteboarded it out, used the latest technologies? A year? Nobody. 5 years? Nobody. 10 years? A few people. 15 years, a lot of hands went up. And I said, 15 years ago? 15 years ago, we were still walking around with like Sony Walkmans, and like just technology 15 years ago was crazy, right? We were on the Pentium chip. Our cell phones had flip phones, right? There was no smartphone 15 years ago. Apple wasn't a thing 15 years ago, really. And I said, do you think technology is different today? And everybody was like, well, of course. I said, do you think you should employ some of that in changing, your processes and leveraging some of that? And everybody was like, well, that makes sense. I'm like, that's digital transformation, right? It's partially tools and technologies, but it's really rethinking how you do business in the modern era. The age in healthcare of, we can't do anything because we're doing our EHR implementation, Epic, Cerner, those were decade-long experiences to implement the EHR. And for the most part across healthcare, that's done now, right?
Yeah.
So now this is the digital transformation decade. It's already started. And the other saying that I like to use is it's no longer a competitive advantage, it's a competitive necessity.
Yeah.
Because if you're not doing it, right down the street, that other provider, they are doing it. And guess what? Their margins are going to be really small compared to yours. And when they acquire you, you can wonder, whether or not you're going to survive that, right?
Yeah.
Because you're going to have more money to provide better patient care. And it isn't about letting people go, which is the other, I'd love your perspective on that. Because oftentimes people are like, well, we care about our people, so we're not doing digital transformation. You care about your people, so you should do digital transformation so that
Yeah.
they can provide better patient care and stop playing around shuffling fax paper around and keying stuff into systems.
Well, as you know, the conventional narrative that came with a lot of the current, wave of digital transformation technologies was that it was going to reduce your headcount. Now the actual implementations haven't borne that out. What they've done is improved operations, improved efficiency, improved productivity, improved quality, and so on, and have had an impact on cost, certainly, but not necessarily with the same impact to personnel that was originally anticipated. I think the thing, and the other thing I think about when we talk about this, and going back to the interoperability question is, healthcare is as guilty as any industry of having a lot of niche technologies and having been on the IT side, this very well, right? There's software for scheduling, there's software for billing, there's software for this function, there's software for that function, and again, they don't communicate well with each other. Maybe you've spent some time building some APIs between the two of them, but probably not. And so, the capabilities today with some of the intelligent automation technologies to be able to literally bridge those gaps are missed opportunities that aren't being taken. And again, do you get to a stage where perhaps you have more people than you need? What many organizations have found is they've been able to redeploy those folks into other parts of the organization or do other more value-added activities than what they were doing with all the paper shuffling and the data entry and navigating multiple systems. So I think, and again, I think it is fair to say for those organizations who have reduced staffing because of reductions in revenue during COVID, had they taken some of these steps over the last 3-4 years to try to start doing this, the impact would be mitigated, in my view, fairly substantially than what it's been today. We would have already been prepared for some of the change that's going to happen. So, and so now, since we don't know at the stage we're in today when we're going to be past COVID, right? Here we are today in September, middle of September 2020. We're 6 months into this, and we're not really sure when we're going to be past it. You've got to start thinking about the long term, and you've got to really start addressing things that maybe you've been ignoring for the last several years that you're seeing everybody else do, but because we're conservative and because we're low margin, and because we're this, that, and the other, we haven't taken the dive. And I want to know what the next guy's doing. Well, I get that. I mean, you and I have both brought new things to the organization, and they want to, and you get the question, well, what is somebody else in the industry done so that I can compare it against? At some point, while there are use cases there now, at some point you just got to say this is the right thing to do, and we got to take this step in order for us to get to the other side.